Good morning, good evening, good afternoon. Thank you all for joining us at this side event for this crucial conversation on SRHR, which is a core to achieving gender equality and for the success of Beijing Platform for Action in SDGs. I'm Shamla Chandrasekaran, and I'm representing the Asian Pacific Resource and Research Center for Women, ARROW. ARROW is a global South feminist organization working on the issues of gender equality and sexual and reproductive health and rights in Asia and the Pacific region. So before we start the session, few housekeeping announcements from our end. This session is sign interpreted, and we are also recording the session. The recording will be available on the NGO CSW platform for those who are not able to join us live today. And if you have any questions and comments, please put them on the chat box. Okay, let's start. So in terms of context, 26 years since the adoption of the Beijing Declaration and Platform for Action, and 6 years since the SDGs, gender equality remains an agenda for which is far from fulfilled. Bodily autonomy and SRHR are important determinants for achieving gender equality. Despite this, SRHR is in its comprehensive form is not prioritized by the states. Women and girls continue to be adversely affected by restrictive gender norms and regressive laws and policies. Violations of SRHR is further exacerbated during the COVID-19 pandemic and is made worse due to the intersecting inequalities and vulnerabilities. Lack of access to SRHR services, including for contraception and safe abortion, also means that women and girls are unable to exercise and have control over their bodily autonomy and sexual and reproductive health, which also affects their ability to participate in decision-making spaces. These inequalities and vulnerabilities are further deepened by the ongoing COVID-19 pandemic, and the shift in priorities by the governments has further left out marginalized women and girls. It is in this context, we are organizing this side event at the CSW 65 to discuss the progress, gaps, and challenges in the acceleration of SRHR agenda and Beijing Platform for Action. The session will facilitate exchange of experiences and knowledge of the CSOs from the Global South who are working towards realizing the SRHR agenda and Beijing Platform for Action. The session will also highlight some best practices and key advocacy initiatives at the local, national, regional, and global levels. In discussing way forward, our speakers will also provide concrete recommendations to the member states at the CSW. It is now my pleasure to introduce the speakers. Our first speaker is Bing from the Philippines. Bing has been an activist for almost 3 decades. She has implemented programs on women's rights, sustainable, social, just, democratic, and accountable multilateral trading system, grassroots mobilization, Southern-led North-South collaboration on aid reform, among others. She is currently the Executive Director at Women's Global Network for Reproductive Rights, WGNRR, a Southern-based global network that strengthens movements for the promotion and advancement of SRHR and justice. She's also a member of the executive committee of the Women Human Rights Defenders International Coalition, an advisory committee for the Safe Abortion Advocacy Initiative, a Global South Engagement SAGE, and a steering committee member of PINSAN. Bing will share with us the progress and gaps in the implementation of BPFA and SGD with a focus on safe abortion in the Philippines, and how has the network organized regionally and globally. Bing will also share concrete recommendations for the member states at the CSW. Over to you, Bing.
Right, Shamala, thank you very much for that introduction, and thank you for this opportunity, everyone. Good evening from Manila. I actually shared earlier to my colleagues that we entered the new lockdown, and we call it now bubble in the Philippines relating to COVID-19. So challenges are everywhere, COVID or no COVID. SRHR has always been a challenge for many of us working in this issue, specifically from the Global South. This topic will be focusing on SRHR as key to gender equality. And right now I'm putting it out that key to ensuring gender equality really is anchored within women's ability or women and girls' ability to decide over her own lives and body. So at that, with that framework, I'm saying that we cannot really achieve gender equality without achieving sexual and reproductive health and rights. Could you go to the next slide, please? Right, there's been tremendous progress with regards to women's rights globally, and also, impacting that in the global South. And there's been progress, and recognizably, we are happy about the victories that are happening around us, but also that recognizing that we are, as women, as peoples, that we have that women's rights, that has been recognized in 1995 when someone says women's rights are human rights, which actually the phrase really came from the global South, that we are recognized as key contributors and vital agents in combating poverty and inequalities. And we are also saying that women's full and effective participation in decision-making are rightly positioned as integral to the elimination of violence, the achievement of gender equality, empowerment of all women and girls, and the key to ensuring women's full and effective participation and decision-making is her ability, like I said, over her own body and life. Yet, as we know, this has not been the case. This is not the reality of women and girls, specifically from the global South. If you can move to the next slide, please. The challenges that I'll be talking to you, of course, we have tremendous challenges. We have multiple barriers to achieving our gender equality and empowerment. But I'll be focusing more on the challenges that talks about our inability to access sexual and reproductive health and rights. And with that, including the information and services that has been prevalent amid the COVID-19 pandemic that are, causing tremendous impact to women and girls, especially us here in the global South. And there is also a fact that there are many countries that still are criminalizing abortion and making it more and more difficult to access abortion services, specifically in this context that we are in right now. Like I said in the very beginning, we are actually in the Philippines right now entering into a new lockdown. And many women and girls, specifically in my context, continue to experience various forms of violence, including the denial of access to services. And in the Philippines, right now, last year, we have seen a lot of denial of services to maternal health that ended actually having women die due to this. And we have also seen this in our partners have reported in many countries, like in Uganda, that pregnant people actually, delivered right off the street along the way going to the facility because of the lockdown restrictions. There are also, a lot of issues around access to maternal health services. And these are maternal health services, essential services. And you cannot imagine how much is it, to access service that are, for many contexts and many situations, are highly stigmatized, such as access to safe and legal abortion. Right, if you can just go to the next slide, please. Right, and these challenges, a lot of it, and I'm not going to, go through it one by one, as we know what are, the barriers to achieving our sexual and reproductive health and rights. This has been exacerbated with the rise of the populist, authoritarian, and misogynistic administration that putting public health at risk. And we have seen this. I mean, in my context in the Philippines, this has been seen how this government have been using, war on drugs, the culture of misogyny and sexism that have resulted to, for example, hesitancy to vaccine, which led to thousands of deaths and also threats to our physical and psychological well-being. And this also are been, COVID-19, as we know, is being used right now by these authoritarian regimes to also curtail the rights of women human rights defenders. In my context right now, we are there is a crackdown on many activists working on issues on health, working on issues on women's rights, working on issues on poverty and other social issues. And this, like I said, the COVID-19 has made things worse. But then again, before the pandemic, sexual and reproductive health and rights has always been a challenge. It was never been easy for us. In the context of Beijing plus 25, we said that we've had progress. We've made a lot of progress. But then again, there are still barriers that pulling us down as women, as people. And like, for example, here, what we have seen as a major barrier, major, manifestation of how the denial of services actually manifested is that there is that rate of unintended pregnancies during this public health emergency. And at WGNR, we've been experiencing a spike of email inquiries regarding options for abortion, and in the context where abortion is restricted, and abortion, there's no services at all for abortion, where these women go. So the challenges are actually being exacerbated by this pandemic that we are experiencing, but these are not new challenges. These are challenges that have been experienced by many of us before the COVID-19. If you can just go to the next slide, please. Yeah, but then again, we persist. As always, we always persist. We are advocating for SRHR in the time of the pandemic. And in spite of this, we always say that, the work continue. We only get creative on the things that we do for the promotion and advancement of women's human rights that are guaranteed within the mechanisms, human rights mechanisms. If you can just go to the next, please. So in terms of initiatives, we did not stop connecting and connecting to people, to our members and partners. We went online. We did a lot of media monitoring. We did a lot of consultations. We do a lot of online workshops, and we had south-to-south conversation to be able to exchange that ideas and experience amid the COVID-19, and how we push for our rights using these instruments that we have right now, in spite of the challenges that we are experiencing. To the next slide, please. Yeah, and these are some examples of our creative methods. We do online boot camp. We've had SRHR, I can't see my own slide. Yeah, we have a SRHR skill session online. And like I said, the work did not stop. We only have to be very creative in this times. Just go to the next slide, please. Manifestations of the work that we do. We do this webcast, online media materials that we produce during September 28, International Safe Abortion Day. We also did some work during May 28, etc. If you can just go to the next slide. Yes, I believe. Yeah, next slide, please. Okay, so we did all these things amid all these pasya, which is actually in Filipino, this is a Filipino word that means decision, like a hard thought decision, which is an advocacy that put together all the experiences of women in this context that I am in the Philippines during the COVID-19, and how we persist in spite of the challenges. And lastly, I would say that one of the biggest initiative that we did in the country is that was that, if you can just go to the next slide, please. I'm sorry. Right. So I think one of the biggest initiative that we did in spite of the pandemic, and to also challenge, the commitments and the accountability of the government to sexual and reproductive health and rights in the Philippines, is to launch the decriminalization of abortion campaign in the Philippines during September 28th of last year. And if you can go to the next slide, that is the bill that is actually we are holding, the paper that we are holding is the copy of the draft bill, the proposed legislation that we are now in consultation with some people in Congress and also in the Senate for us to be able to, to come up with a legislation to widen access to decriminalize abortion in the Philippines, which right now actually is killing women, 3 women each day due to unsafe abortion. Right. Next slide, please. All right. If there is, I was asked to have that, a recommendation to the member states during the CSW 65. So I actually really have to underscore that any public health strategy that is not mindful of human rights, including sexual and reproductive health and rights, will not only be inept and unsustainable, but will also create an enabling environment for grave human rights violations. So we say that government should undertake a rights-based, reproductive justice, and sustainable development approach towards COVID-19 and any other emerging issues, because COVID-19 is actually one of the things that we have to, we are facing, I think, not only for this year but beyond, because we are not only talking about the denial of services, we are also talking about access to services. We're also talking about even access to vaccine and how the vaccine is actually being rolled out and how the marginalized peoples are going to access those vaccines. So with that, I'm just going to stop. Thank you very much. Maraming salamat.
Yeah, thank you, Bing, for highlighting the situation in the Philippines and also during the COVID situation. And we must say that we see this pattern across the region affecting the SRHR of women and girls severely. As you have rightly pointed out, access to services, especially to safe abortion, has become even more difficult during this COVID crisis, right? And I also see someone in the chat has said, great presentation, making a link between SRHR and gender equality. Right, so our next speaker is Shanta Lakshmi Shrestha from Nepal. Shanta is honorary chairperson of Beyond Beijing Committee Nepal, BBCN. BBCN is a human rights feminist network organization committed to achieving gender equality, women's human rights, sustainable peace and development. Shanta is also a think tank member of the Ministry of Women, Children and Senior Citizen and the Asia coordinator of CSOs for Partnership for Development Effectiveness, Feminist Sector. She was the forefront of human rights movement and She Decides movement in Nepal. She established the Women's Human Rights Award in 2015, and she continues to be actively engaged in the UN processes on BPFA, CPD, and SDGs at the local, national, regional, and global levels. Shanta will share with us the progress and gaps in the implementation of BPA and SDGs with the experience of BBCN's organizing at the national and local levels with concrete recommendations for the member states. Over to you, Ms. Shanta.
Thank you, Samala. Thank you very much. So are you sharing from that end? Okay.
Yes, yes.
Okay. So first of all, I really thank Arrow for really organizing this event, very, very, very important event. While we are having this 65 CSW session to really review Beijing Platform of Action, though we couldn't have opportunity to commemorate 25 years of Beijing because of the COVID, now bringing that, so I think we need to really celebrate that as well. So I will focus mainly on, the Beijing BPFA. As the name implies, Beyond Beijing Committee focused on Beijing Platform of Action. And within that framework, how we were able to achieve one of the very important, crucial issue of safe abortion, one of the issue of SRHR for all in Nepal. So in that framework, I am going to present. So shall I share or you share? Okay, so this is just to give, how should I say, just to really celebrate 25 years, 26 years ago, this, Fourth World Conference on Women, and it was started for peace, equality, and development. Yes, next. Just to bring back the memory, yeah. And this Beijing conference adopted Beijing Declaration and Platform for Action, and which has really established gender mainstreaming within the UN system to achieve gender equality. By now, I think as per the UN General Secretary, gender parity is achieved in the UN. And because of this Beijing Platform of Action. And this Beijing Platform of Action is enshrined with human rights, gender equality as the human rights. And it has 12 critical areas of concern, and then platform of action for substantive equality. And within the 12 critical areas of concerns, one of the concern is women and health, because women and health is prerequisite within the health, sexual and reproductive health. Without having healthy sexual and reproductive health, no human being will be really healthy enough. Yes. Next slide. Yes. So I just wanted to reiterate that gender equality as a human rights, it is the Beijing Platform of Action framework which brought gender equality as a human rights. So I have just took it from the Beijing Platform of Action here. Next. Yeah, so when we talk, it really emphasizes an equality in outcome, substantive equality. So what does that mean is not only access to opportunities and resources, but power relationship, healthy power relationship between human being, and moreover now the value by virtue of equal value of all human beings, regardless of sex and sexual orientation and gender, that's being a human being. Yeah, so the sexuality is very, very important. So there should not be discrimination based on the sex. Yes, next. So, and this BPFA had advocated twin track approach. One is mainstreaming approach and another is targeted approach. Next. So when it comes to Nepal, in Beijing Platform of Action, we have really achieved a lot. So in terms of, because Nepal has, after 1995, in Nepal, as a result of Beijing Platform of Action, Ministry of Women, a ministry was established after Beijing Platform of Action. And that ministry has really acted to mainstream gender equality in all the sector, including health, and also ministry has functions as a targeted ministry for gender equality and empowerment of the women. Because of application of these two approaches advocated, recommended, prescribed by Beijing Platform of Action, in Nepal we have achieved gender-friendly constitution because these are the 5 major achievements we have: a more gender-friendly constitution and legal framework, a substantial improvement in women's representation in public sphere, increased access to education and higher education, educational achievement, including incorporation of SRHR, not comprehensive sexuality education fully, but it is included in the educational school education. and significant improvement in maternal and child health, increased access to economic resources, land, property, and microcredit. These are the 5 areas which have progressed in Nepal. Yes, next. Yeah. However, there are lot of barriers in achieving substantive equality. But unless we achieve substantive equality in outcome, equality in value of human being, as not as sex being, as not as a gender being, but as a human. That is very, very important. We have still many barriers. These barriers in terms of constitution, capabilities and resources, the violence against women and girls, voice, agency, and leadership. Agency, the sexuality is very, very important when it comes to advancing agency of every person, particularly women and girls. Yes, next. So, as the name implies, this Beyond Beijing Committee, taking the torch from the Beijing, established in Nepal for the women's human rights, gender equality, peace and development, continuously since that period. BBC is building capacity and evidence and knowledge and skill and building awareness about all 12 critical areas of concern and the principle and practices of BPFA. It has mobilized NGOs, CBOs, and build our network, and it does advocacy at the UN level and at the grassroots level. And it is carrying the torch of Fourth World Conference on Women and using ICPD, BPFA, and CEDAW and the Agenda 2030 in order to realize SRHR for all. Yes, next, yeah. So again, BPFA advocated, these 2 mainstreaming approach and targeted approach, I said already, yeah. Next. So now I would like to give a good example of implementing BPFA. Next. Yes, BBCN is practiced to keep instigating Beijing platform of actions, women's health, ICPD, continuously by being a bridge between local and the global. So global to local and local to global. For doing so, the BBC as a practice, as a culture, it review annual reviews, and by doing consultation in BPFA, ICPD, CEDAW with the stakeholders, and then develop call for action, and then participate and lobby the UN CSW session, sharing report and agreed, and then again share back the agreed conclusion, outcome document of the UN session to all stakeholders up to the ground level. We share with the duty bearer, ministries, government organization, at the same time, the claimant, the right holder, the people, the local people. So this is the practice we have been doing in a circular manner by publishing these reports in Nepali and English in both. So this is one of the, we consider this is as one of the good practice. So for this Beijing Plus 2025, this 25 years review, with the support of Bureau, we produce national report, and we did, as we all know, in Nepal now the federal system. So now we have 7 provinces. So we did consultations in all the 7 provinces, and we produce advocacy brief. We produce the profile of BPFA, Beijing Platform of Action in every province, and then we prepare advocacy brief both in Nepali and English, along with a position paper of feminist leadership and feminist women's movement movement in Nepal. So these documents are also prepared in Nepali and English and disseminate at all levels in order to really share where are we in the process of implementation of Beijing Platform of Action, ICPD, and CEDA. Because this year, the Beijing Platform of Action, the framework we have used is CEDA, BPFA, and SDG, synergistically reviewing all those things. Yes. Next slide. Yes, sorry. This is again, next slide. Next slide. Yeah. So when it comes to the progress, now I have shared the progress in BPFA. Now I would like to share about SRHR in Nepal. Yes. Next slide. Yes, I think I feel very proud to share that Nepal has really progressed in terms of one of the very, very crucial issues of SRHR, that is abortion. So I'm sharing a saga of success in safe abortion. Before 1995, 1994, unless we had this ICPD program of action, I think this abortion was not an issue in itself. But after ICPD and Beijing Platform of Action, it became an issue, SRHR issue, women's issue, very vibrantly. And with that advocacy, abortion which was non-issue. Many women were criminalized or put it in the jail. So, so addressing that, abortion is legalized and then implemented since 2003, and we have safe abortion service started in 2004, and then we were able to make this safe abortion free in 2015 in the public health institution. And then apart from that, we were really able to make safe motherhood and reproductive health right as a fundamental rights of women and girls in our constitution. This is really a great achievement. We really underscore it. And in 2016, we have free abortion service directive was passed and started implementing. And then in 2018, Safe Motherhood and Reproductive Health Act promulgated. And now Safe Motherhood and Reproductive Health Regulation was passed in 2020, very recently. Now it is a time to really implement the Safe Motherhood and Reproductive Health Act, which inclusive of safe abortions and other four components. So this is one of the success story we would really like to share, and this is because of ICPD and BPFA and SDG as well. Next slide. Yes, so far the leadership is concerned in the health also. If you look at this, the number of women in leadership and in public decision making also increased. So health is one of the area where we have 46.94 female percentage in our health sector. So it is very, very important to have women's more representation, more participation in order to achieve SRHR for all. Next. Yeah. So the barriers when it comes to policy barriers, sociopolitical still, sociopolitical, cultural, and governmental and economic resources are the major barriers in implementing this now safe motherhood and HR policies, SRHR related policy. Next. Yes, the challenge is again in Nepal, bringing policy is not that difficult when we really advocate unitedly to the policymaker people, but changing the perceptions towards women's body, their role in society, and their sex and sexuality is very, very difficult. And this is really a great challenge for us. Similarly, the men's role, perception towards men's role in SRHR, and changing the perception concerning masculinities and feminities, and changing people's perception of reproductive health issues and role of men is still a very, very challenging, though we have HR Act and HR regulation is in place. Next. Yeah, so the recommendation I would like to give is revitalize Beijing platform of action and continue application of two-pronged strategy in a more strategic way. Seriously, address systemic barriers, patriarchy, globalization, fundamentalism, militarism, so as to realize SRHR to achieve gender equality. Because SRHR is very comprehensive. Without this, in order to really achieve SRHR, we really need to act comprehensively, not only health, but in all other sectors, SRHR has to be mainstream and generate gender responsiveness in every person, and also foster finance feminist women's movement to bring transformational change to realize body autonomy and SRHR. Only I think without feminist women's movement, strong feminist women's movement, who do not realize, internalize the importance of SRHR, I think we may not really achieve SRHR in reality. Thus, this is very, very essential. And advocate and act. There is an act is missing here. Advocate and act until we achieve SRHR for all. These are the recommendations I would like to put forth. Next, I think there is one slide. Yeah, thank you so much. This is all so that we can achieve equality all over, including in the sector, in the field, in the issue of sexual and reproductive health rights. Thank you so much. Thank you for listening.
Thank you, Shanta, for the very energetic sharing on the important work that you do in Nepal. It is good to see the progresses that you have shared, at the same time acknowledging that there are still barriers that need to be addressed. You've also shared some good advocacy practices in localizing the BPFA. So that was really, really informative. Now we move to our next speaker. Our next speaker is Ashrafun Nahar Misti from Bangladesh. Misti is a wheelchair user. She's the founder, executive director of Women with Disabilities Development Foundation in Bangladesh. She has long experience for disability inclusion in development plan and programs. She works as a women's rights activist devoted to build leadership capacities of WWDs and raise voice for non-discrimination beside policy advocacy. Misti will share with us the progress and gaps in the implementation of BPFA and SDG from the experience of women with disabilities and their organizing at the local and national level. Misti will also share some concrete recommendations for the member states at the CSW. Over to you, Misti.
Thank you so much. Hi, everybody. I think that all we are safe, and thank you, Arrow, for organizing such the important event today, because sexual and reproductive health rights is really key to gender equity. Most of the time we always forget that the sexual and reproductive health rights is our human rights, because we do not want to get more concern or more time to think about the sexual and reproductive health rights for all, not only for men or women, but also girls and women with disabilities. The needs of persons with disabilities are often overlooked and ignored. Disability is everyone's business though. Because people with disabilities think as a minority group, and they have less priority to talk about their sexual and reproductive health rights. But we must think that SDG Goal 3 ensure health, lives, and promote well-being for all at all ages, which consists them for all criteria and circumstances for all people's health well-being, including girls and women with disabilities. So there is some progress in Bangladesh to incorporate disability inclusion in we have national health policy, we have national strategy adolescent health. It is for 2017 to 2030, like achieving SDG goal. Regarding sexual and reproductive health service, the government initiates some center for get SRHR service from community clinic, mother and child care center, maternity child health care center, Upazila family planning service. This SRHR services center is not really inclusive for girls and women with disabilities. So we always raise our voice that we must not be excluded any personal identity, however sexual minority or having disability or ethnicity. Department of Family Planning of Health and Family Welfare of Bangladesh are trying to ensure youth and adolescent friendly health service in the country. And you know, Bangladesh is very much famous to going a digital Bangladesh. Recently, both ministry considered disability friendly inclusive health service for all citizens of Bangladesh. And now Shirin Akhtar, chairperson of our organization, Women with Disabilities Development Foundation, is working as consultant for last 3 months for prepared and disability inclusive standard operative procedures on SRHR and family planning. So it is one of the most positive indicator to the disability community that some progress is happening and will happen in near future. But you know, Bangladesh have lots of policy advocacy, but not only Bangladesh, maybe many of the countries are very weak to implement the law and policies which is we pass from our national parliament and through our other procedures. So regarding sexual and reproductive health services, we are thinking that despite this policy service center, this is still problems or challenges faced by persons, particularly women and girls with disabilities, to receive health service, as there are huge gap in accessibility, acceptance of people with disabilities, because there is still remaining myths and discrimination from the different states of public lives related not only healthcare, but also other provisions like rehabilitations, home-based hospital facilities, etc. There is actually, if we think what is the barrier and challenges, we can think that in very broad format, that physical inaccessibility, negative attitude from health workers, social discrimination, long queue to health facilities, high cost of health services, because in our country we do not get health insurance or do not free health service for all. Our health minister recently said that we will cover our health system in very fast mode through using digital technology. Through this very important digital system, we will be able to preserve the past disease history of each patient, which will be help him or her whether ever he goes to get treatment. She will not face any difficulties for further treatment if she or he needed. Besides this, our minister said that there will be used some machine and facilities, infrastructure facilities. But that will not be very friendly for people with disabilities, because most of the women and girls with disabilities are living under the poverty line, and their status is ultra poor in the community. They do not have the Android or even button mobile phone. Then how they will get the coverage, health coverage from the digital system of Bangladesh? And they not have access internet facilities, especially in the rural area. The urban area and rural area, there is very far picture. There is very different picture if you go to urban and if you go to the rural area. Even the girls and women with disabilities who live in the rural area, they do not have the very important, important for their lives is assistive devices. So assistive devices is the part of their life. They do not get it free service from the government. But many of the countries, they think for the provide the support for the rural people with disabilities or urban people with disabilities, what type of assistive devices they need. The sign language and messages are not used to communicate with the patient, that will not reach to patient with hearing and speech impairment. Like now we are going through the COVID situation. We get so many messages from our government and CSOs through our mobile phone, as we need to make some awareness when the COVID is increasing in different areas. But the hearing impaired person, they get the message, but they cannot communicate through message, because that is one-way options. And the health community people, they do not understand the hearing and sign language. They do not understand the sign language. Doctor is not habituated to understand the sign language, and there is no facilities for the sign language users. Most of the cases, the doctors and the nurses do not use the emails related SRHR information, because if adolescent women or girls with disabilities goes to hospital or any health service provider, they do not get any support from them. WTDF make awareness and sensitization SRHR since 1914. That was 2014. So far, I know that this is the first organization who is thinking for SRHR information for girls and women with disabilities in our country. After that, WTDF trying to advocacy with government and CHOs to take SRHR issues as emerging issues for girls and women with disabilities. Otherwise, girls and women with disabilities do not understand about their rights, and they face a different type of gender-based violence in different situations. So when the girls and women with disabilities face gender-based violence or sexual violence or rape, that time they need some medical tests, but this is not free for them because of our health system. So WTDF is trying to mobilize, sensitize, mobilization and sensitization, awareness on the SRHR with the government authorities also. WTDF also implement the project on ending violence and raising voice of girls and women with disabilities on SRHR, and conduct different type of trainings related SRHR for girls and women with disabilities in different areas. Our recommendation is very clear, that we need a multi-component strategy to improve access to services, definitely health services. sex education in school is important. I think that there is some sex education chapter in our some books in higher secondary schools, but teacher does not teach to student. They say that you can go home and read this chapter. So this is not proper sex education in schools actually. Promotion of youth-friendly health clinic, because most of the clinic is not youth-friendly and not disability-friendly. More and more research on SRHR, disability and non-communicable disease is important. Ensure all SRHR programs, research and service to every person with disability is also important. Raising awareness and increase accessibility in house, attention to the needs of persons with disability should be an integral part of current work. Address disability in national SRHR policy, laws and budgets. We do not have a budget on SRHR, so we can think about this, about the budget. Promote research on SRHR for persons with disabilities in different countries. This is our recommendation basically, and I think that we can bring symbolic changes if we do not follow the inclusion in every service system in any country. So we always think not for exclusion, think for inclusion. We always talk about that exclusion is make harm for the society and it make inequity towards the citizens of country. Thank you so much, everyone, to give me opportunity to brief discussion on these issues, and thanks again to hear from me. Thank you. Do not hear from you, Samaladi.
Microphone. Oh, there is no microphone. Can you speak?
Can you hear me now? Yes. Yeah, sorry about that. Thank you, Misty, for the insightful sharing, highlighting the intersections of disability and SRHR. And also thank you for the work you are doing with women and girls with disability. And now we move to our last speaker, Menka. Our last speaker, Menka, is from Fiji and is a feminist activist. She's currently the senior program manager at the Fiji Women's Fund. She's also a member of the Program Advisory Committee of the Asian Pacific Resource and Research Center for Women, ARROW. Menka was formerly employed at the Fiji Women's Rights Movement and has been a past secretary to the NGO Coalition of Human Rights in Fiji. Menka will share with us the progress and gaps in the implementation of BPFA and SDG from the experience of women in the Pacific and also challenges women face due to climate change related disasters with concrete recommendations for the member states at the CSW. Over to you, Menka.
Thanks, Shamala. Thank you for the introduction. I'll try to link the SRHR in the Pacific and some of the strides we've made in relation to BPFA, and also linking it to women's leadership in decision making, which is the theme for this year's CSW. One of the greater outcomes out of BPFA in the Pacific has been the realization of the Gender Equality Declaration or the Pacific Leaders Gender Equality Declaration. So that has really put Pacific leaders and Pacific governments to action in terms of gender equality, and it emphasizes the need to implement specific policies, at their national levels in relation to gender equality. And so there has been from a global to a regional shift in terms of action, and then from the region translating to national. So you would see in the past decade or so, a lot of the Pacific Island countries have developed their national gender policies or their women's plans for action. And these all have come after 1995 or after the Gender Equality Declaration by the Pacific leaders. So that has been one of the strides which, has been in relation to the BPFA and realization of that in the Pacific. Whilst we say that, one of the things that is notable is the fact that the Pacific, like you mentioned, is in the front line of climate change. And a lot of our daily lives are impacted by climate change and or climate-induced disasters. And so based on that, climate change has had a negative impact on women's maternal health, and also climate-induced disasters have also, so we've seen an increase in gender-based violence in the Pacific in or around natural disasters or climate-induced disasters. In fact, only last month, a WHO study came out on GBV, during which we can see that 3 out of the top 5 countries in terms of gender-based violence is situated in the Pacific. But that's how grave gender-based violence issues are in the Pacific, and with exacerbated disasters, we have seen an increase of gender-based violence in around those disasters. Now, COVID-19, now if I had to link it to COVID-19, that globally, the trends we've seen globally with restrictions, with the economic downturn, etc., and also the Pacific being heavily reliant on the tourism industry, which is dormant at the moment, that has all increased the rates of gender-based violence across the region. So there is no discounting on what the WHO research has shown. It does depict a good picture of what the realities of women in the Pacific. And also the climate disasters put a strain on the capacity of health systems and hinders access to SRHR. I think the previous speakers have spoken about the challenges we face in relation to health systems and SRHR, and now coupled with climate-induced disasters in the Pacific, and the frequency of climate-induced disasters that we're getting becoming higher by the year, increases the risk of health infrastructure damage. And so the capacity and strain capacity it puts on health infrastructure and the limited health infrastructure we have across the Pacific is just enormous. And so without speaking any further about it, some of the recommendations I would say are enhancing collaboration between climate change, health, and women's rights or advocacy. So one of the things we don't see, and the reason why I say that as a recommendation is we don't see a lot of collaboration between climate change policymakers, health policymakers, and women's rights or human rights activists. Essentially, what it does is it disproportionately disenfranchises women from decision-making and policy-making tables in relation to climate change, in relation to health. An example is in Fiji, we've got the national health policy, which also has a specific paper on national health in relation to climate change. But what we don't have is the fact that that in a lot of instances, there is lack of data showing how women are disproportionately disadvantaged in climate-induced disasters in relation to gender equality, or in relation to SRHR, or in relation to access to health services. The other thing is that women are often not consulted, and women are not in the policy-making tables or decision-making tables when this happens, or when policies are being drafted and billed to Parliament. So that is one of the other things that we need to see more greater collaboration in. And so the other is setting targets for inclusive gender balance and multi-sectoral and stakeholder participation in climate change policy. So the targets we have in terms of indicators for the national policies that have been set up over the years is does not account for gender mainstreaming or gender responsive analysis, really. One of the things the Pacific governments have been trying to work on for the past few years is around gender responsive budgeting, and yet we don't see specific resources for SRHR, and which brings me to the next recommendation, which is on realizing the full range of sexual reproductive health and rights in order to prepare for, respond to, and recover from climate-related disasters. So we have lack of services available when it comes to SRHR. Usually, like I said, like I alluded to, we don't have specific resources. We don't see specific resources for women. We don't see specific resources for SRHR in health budgets, let alone SRHR being interlinked to climate change. One of the other things is it's very hard for women's rights organizations, for service delivery, GBV service delivery organizations, for SRHR service delivery organizations to get into getting or receiving resources from climate change funds, because climate change and climate adaptation programs, resettlement programs are not usually interlinked to this type of work because of the data-less society that we are currently in relation to these interlinkages. So that is one of the recommendations that that we need to see, that there is women being able to talk about their rights, talk about their sexual rights, their bodily autonomy in relation to climate change, in relation to climate-induced disasters, the realities of it. These are able to be captured in policy making, in national plans, etc. And realization of work needs to happen. So all of this needs to happen in an appropriate fashion. And currently we don't see that happening. In the longer term, I've spoken a lot about climate-induced disasters. I think in the longer term, we have quite a few communities earmarked for resettlement in the Pacific, some including here in Fiji. And in resettlement even, as excruciating as it sounds, to resettle your home, which you probably would have been in for generations, to another ground, the traditional knowledge, the expertise of women, and women's division of labor is also something that has not been fully interrogated before resettlement plans are made. And therefore women lose a lot of things as simple as access to clean water. And we know that access to clean water is pivotal for, you know, the baseline of having access to conducive sexual health for women, for any individual for that matter. And so that is one of the things as well that we, you know, we need to consider. Sometimes it's not about the bigger health services, bigger health, you know, have access to reproductive services, health services, but it's also around something as basic as having access to clean water, etc. Also, some of the things that we, you know, don't talk about is the loss of identity for women, which is related to the lifestyles they live. In a very real example, very recently I had the opportunity to visit a maritime island which has been resettled by descendants of Tuvalu, because because of the rise in sea level, they were losing their atoll island, and so they've been resettled 2 decades ago in a part of Fiji, as the government of Tuvalu had bought that piece of land. One of the things I did notice, and something that the women in the community shared, was the increase in NCDs and the increase in reproductive cancers that they're going through. And in just spending time with the community, you get to know that they have lost, and they do share with you that they've lost their traditional knowledge of their planting practices. They've kept some intact, but not all. And so naturally in their resettlement, they have become more reliant on processed foods, in different eating habits, etc., from what they used to in their traditional home. And that is why their population is now more prone to NCDs, more prone to cancers, etc. And so that is understudied. We don't usually access these communities and talk about it in this way, that these are the effects of resettlement that we've already seen because of climate change. So those are some of the examples I've had from the Pacific, and some of the recommendations that I'm making in relation to SRHR, gender equality, climate change. Yeah, and I guess that's all from me. Thank you.
Yeah, thank you, Menka, for the informative sharing, especially on how climate change is affecting the lives of women and girls in Pacific, especially from the gender-based violence aspect, and also linking impact of COVID in this context and how it is hindering access to SRH. Yeah, so now due to time limitation, I will quickly summarize the sharing from our esteemed speakers, reiterating our speakers. Agenda of Beijing and SDGs are only possible when the SRHR of all are upheld. In order for this, the member states should address systemic and structural barriers and ensure an intersectional feminist approach to strengthen the implementation of BPFA ICPD program of action and also the SDGs, to ensure progressive policies and laws that address the need for contraception, and stressing here, very importantly, access to safe abortion as part of the universal health coverage that is acceptable, affordable, accessible, and of high quality. And also ensure progressive, also undertake a rights-based reproductive justice and sustainable development approach towards COVID-19 and other emerging health issues, and increase accessibility to SRHR services for persons with disabilities. So as CSOs, we need to continue organizing, including for Generation Equality Forum that is taking place next week, and the implementation of the GF Action Coalitions at all levels, including local, national, regional, and global levels. So as Shanta said, we need to advocate until we reach achieve SRHR for all. And yeah, thank you all for joining, and thanks to all our expert speakers for sharing their valuable insights and experience at this event with Arrow. Thank you, everyone.